Last Friday, a new report about tularemia in the United States from last decade, 2001 to 2010, was published in the CDC's Morbidity and Mortality Weekly Report, the MMWR. The report revealed some interesting data from the national surveillance during the last decade. Joining me on the phone is one of the authors of the report, Dr. Christina Nelson. Dr. Nelson is a medical epidemiologist with the CDC's Division of Vector-Borne Diseases in Fort Collins, Colorado. Hi, Dr. Nelson. Thanks for taking the time to join me today.
Hi, thank you. My pleasure.
Great. Well, let's start out with a little general information on tularemia, because there may be listeners out there who may never heard of the disease. So, what is tularemia?
Tularemia is an infection caused by the bacteria Francisella tularensis, and it's a zoonotic infection, which means that it's a disease of animals or a bacteria that's carried by animals that can then go on and infect humans. Tularemia is also commonly known as deer fly fever or rabbit fever.
Okay, and people contract it how?
Actually, there are many different ways people can contract tularemia. It's actually quite an interesting infection for this reason. Probably the most common way people can contract it is through direct contact with the skin. And so one example of this would be people who are hunting who may touch an infected rabbit after they've killed it. They can get tularemia through the skin that way. Other ways include insect bites, so certain species of ticks, dog ticks, wood ticks, and lone star ticks, and also deer flies carry tularemia, and if you get bit by one of these flies or ticks, then you can actually get tularemia that way. Inhalation is another way that people can contract it. This sometimes happens through landscaping work. If people inadvertently mow over a dead rabbit or other rodent, they can get it, inhale it that way and get infected. And also laboratory work. People who work with tularemia in the laboratory may possibly inhale it and get infected that way. And the last way people can contract it is through ingestion. And so this can be either through infected meat or infected water. Infected meat would be if an infected animal, if someone is consuming an infected animal and the meat is not cooked properly. Infected water happens less commonly in the United States, but has happened in Europe, for example. In 2011, there was an outbreak in Norway, and that was associated with contaminated wells. And they think what happened is there was a lemming die-off during this time, and the wells were contaminated by melting snow that then infected the wells, and people drank that contaminated water.
Interesting. And there's a range of diseases physiologically that tularemia can cause, ranging in different types of severity. Can you describe that briefly?
Right, yeah, that's a very good question. So the general symptoms of tularemia include fever and fatigue, but the specific signs and symptoms vary depending on the route of infection or how the infection has entered a person's body. And so the most common form of tularemia is called ulceroglandular, and that means a person will have an ulcer either at the site of a tick bite or where they touched contaminated animal. They'll get a little ulcer or a sore in their skin, and then close to that they'll have an infected lymph node, and so they'll have lymphadenopathy or swollen lymph node near that ulcer. That's the most common form. There's also pneumonic forms if the organism is inhaled, and so that presents as pneumonia and cough. Glandular is similar to ulceroglandular in that people have swollen lymph nodes, but they don't actually have the ulcer, but that can happen sometimes. Less common forms include oropharyngeal, and so that is an infection of the mouth and the throat and presents as a sore throat and swollen glands around that area, and that is caused by ingesting the organism. Oculoglandular is an infection of the eye, and so, for example, if someone has touched contaminated meat or a contaminated animal and then touched their eye, then they can get an infection of the eye. And then the last form is typhoidal, which is a bit of a confusing term, but it basically means that people have the general signs and symptoms but don't have one of these specific presentations that fit into another category.
Okay. And since this is a bacterial disease, it can be treated with antibiotics.
Right. Yes, tularemia is a treatable disease, and it's so for this reason it's important to recognize it early and treat early. If people are treated early, then the outcome is usually very good, and there are certain antibiotics that are good for treatment of tularemia, and those include gentamicin, doxycycline, and ciprofloxacin.
Before I get on to the MMWR report, something just crossed my mind. You mentioned a variety of ticks that can transmit this. Do you ever see co-infections of tularemia with Lyme or Babesia or anything like that?
Co-infections have not been reported, to my knowledge, with tularemia and Lyme disease, and the reason for this is that these two diseases are transmitted by different ticks, and so tularemia, as I mentioned, is transmitted by dog ticks and Lone Star ticks. Lyme disease and babesiosis are transmitted by Ixodes ticks, so we have not seen reports of co-infections with those, yeah.
Okay, great. All right, now on to the report. Based on the national surveillance in the U.S. the last decade, which parts of the country are most prone to tularemia, and why?
That's a great question. Yeah, so the central states have the highest rates of tularemia and would be considered the most prone to tularemia. And, sorry, what was your other question?
And why are the central states the most prone?
Oh,
what makes them unique, you know?
Yeah, the reason for this is multifactorial, definitely. Since this is a zoonotic infection, there are many factors that go into why it occurs in certain areas versus others. And so we have the host, which is the animal species that harbor the organism, and then the vectors, which are the ticks and the deer flies, and then the human interactions with both the hosts and the vectors. And so in the central states, we believe there is a good deal of rabbit hunting, and so people can be exposed that way. And also there is the tick vectors are also very common there, and so we think that those factors contribute. Climate factors also contribute, and historical factors in addition to that, such as including including prevalence of the organism in the past and maintenance in these zoonotic cycles.
Okay, great. And when I was looking at the report, Massachusetts looked oddly out of place in the list of states with the highest incidence. And it also showed a 155% increase compared to the prior decade. Any thoughts on what's going on in Massachusetts?
Yeah, Massachusetts is a very interesting situation, and just a little bit of background historically. As we discussed, tularemia is concentrated in the central states but can occur all over the United States. But starting in 1937, there was actually an importation of rabbits for hunting to Martha's Vineyard. And some studies have shown and hypothesized that this was the reason for the focus in Massachusetts and specifically in Martha's Vineyard of tularemia. So that's just some interesting background. And you are correct that in the MMWR, we found that the highest incidence overall was in Dukes County, which is where Martha's Vineyard is, and that compared to the previous decade, there was a 155% increase. So I spoke with some of my colleagues at the Massachusetts Department of Health to get their take on this, and there was an outbreak of pneumonic tularemia in the year 2000, and they do believe that there has been a true increase since then. They believe that there's no evidence that it's related simply to increased reporting or increased recognition of the infection. They actually do think that there are more infections, but they're not really sure why this is the case. It could be related to ecologic changes, and they've also noticed that the increase in proportion of patients who have the oropharyngeal forms and also oroglandular, which come from tick bites. And so it's multifactorial. We don't really know all the reasons, and it will be subject to, hopefully subject to future research to determine this.
All right, very good. And my radio show, of course, is based in Clearwater, Florida, so I guess I should ask you, are we seeing any tularemia in Florida?
Yeah, so as you can see from the report, there were 2 cases reported in Florida between 2001 and 2010. That is quite a low number, and actually both of those cases were acquired elsewhere. They were travel-related. The people were in New England and actually returned to Florida. They were exposed in New England and got sick when they were in Florida. And it's important to note that surveillance cases of tularemia are reported by county of residence and not by county of exposure. And so the cases that we did see in Florida were not acquired in Florida. With that said, tularemia has been acquired in Florida in the past, and back in the 1980s it was acquired there. And so we aren't sure why it has decreased in Florida.
Okay, well, that's good to know.
Yeah.
And one thing about the comparison of last decade and the previous decade, 2001 to 2010 and 1991 to 2000, really no change in numbers. Was that expected, unexpected? What do you think about that? Did you expect tularemia to go down or go up based on different ecological factors and climate and whatever?
We weren't really sure what we would find. We weren't expecting a large increase or decrease because we hadn't heard of large increases or decreases in certain parts of the country. But we were a little surprised that the number was so similar to previously. 1,208 cases were reported for this time period, 2001 to 2010. But the number of cases is likely more in reality due to underreporting and underrecognition.
Sure.
But it was interesting to us that the number was so stable.
Yeah, and let me go ahead and close with this bioterrorism question. Francisella tularensis is considered one of those microorganisms that could be used for a bioterror act. It's considered a Tier 1 agent. Can you go ahead and explain to my listeners what that means?
Sure. Tier 1 agent was listed by the Federal Expert Security Advisory Board as an agent or an infectious agent that can cause devastating health or economic effects, has a low infectious dose, and a history of or current interest in weaponization by one or more countries. And so they classify these agents so they can be monitored more closely, and so people can be cognizant of what agents are potential bioterrorist agents. Incidentally, they were recently recategorized. They used to categorize them as Category A, B, and C, but recently they changed them to Tier 1, and it now includes 11 agents. And so in addition to tularemia, that includes and the pathogens that cause anthrax, plague, Ebola, botulism, and some others. And so tularemia is classified as a Tier 1 agent for the reasons I listed previously. It does have a very low infective dose, and so as little as 10 organisms can actually cause a person to get sick. It has been researched as a weapon in the past by the U.S., Russia, and Japan, we know of at least. And tularemia can infect via aerosol. And so if it's spread in a powder form by aerosol, people can inhale it and get the pneumonic form of tularemia, which is one of the most severe forms of the disease. So for these reasons, it is listed as a Tier 1 bioterrorism agent.
Let me just follow up on that real quick, then I'll let you go. I know with anthrax, there is documented cases of different groups trying to use it as a bioterror agent. Is there any documented cases of anybody trying to use tularemia?
So let me open up my source here.
I've never read of any, but I was just curious if you knew of any.
Yeah, so there's a publication in JAMA, in the Journal of American Medical Association, titled Tularemia as a Biological Weapon. And so you might look into that. But so in this report, they say that there were Japanese germ warfare units operating in Manchuria back in the 1930s and 1940s, and it was one of the agents that was studied at that unit for use as a bioterrorism agent. And back in the 1950s and 60s, the U.S. military developed weapons that would disseminate Francisella tularensis aerosols. They have since stopped that work, and the work that the United States does now is all defensive, not development of weapons, but it's defensive. But yes, there are documented cases of use in the past, and then according to some sources, and these are, this is public knowledge, it's listed in this publication, but some former, who is this guy, Alabeck, some people who formerly worked with the Soviet Union biological weapons program have also claimed that there was a large effort by the Soviet Union that continued into the 1990s to develop and stockpile Francisella tularensis as a bioweapon.
Oh, very good. Well, this has been very informative. I want to thank Dr. Christina Nelson with the CDC Division of Vector-Borne Diseases in Fort Collins, Colorado. Dr. Nelson, thank you for your time and your expertise. I appreciate it so much.
Thank you very much. It's been a pleasure.
You bet. Bye-bye.
Bye.